morning, everyone. Myself, Dr. Atul Sharma, Module 1. Now, Essential of Sports Injury Prevention and Rehabilitation. In this module, we are going to read about the relevant anatomy of upper and lower limb and various types of injuries and their how we can prevent those injuries and rehabilitation of these injuries. In this module, we will read about the bony anatomy, various muscle, that is musculature of the upper limb and lower limb. So students, first we will learn about the anatomy of the upper limb. In this, first we will learn the bony anatomy of upper limb and the musculature anatomy of the various muscles of the upper limb. Upper limb, as such, as we all are aware, it's made up of arm, forearm, fingers. But in the anatomical meaning, it consists of humerus, radio, ulna, wrist bone, that is carpal bones, metacarpal bones, and phalanges. Apart from this, upper limb, humerus, radioulnar, carpal and metacarpal bones, there are two more interesting bones which are part of our upper limb. One is scapula and the other is clavicle. Scapula is our is also known as wings bone and clavicle is also known as collar bone. Clavicle transmit the weight of our upper limb to the trunk and the scapula provides the complete movement of our shoulder girdle. Scapula is a flat bone and which rotates over our thoracic cavity. I just draw the sketch of scapula. This process is known as a acromion process. And that shallow cavity is glenoid cavity. And this, and with the help of clavicle, it makes shoulder girdle in which head of humerus fits in this cavity. And the clavicle bone transmit the weight of our upper limb to the thoracic cage. So it's a very small bone but very important bone. Humerus is the our arm bone. It's almost a feet uh, long bone. It's around 12 inches or more than 12 inches as per the height and of the individual. It's located between the shoulder joint and the elbow joint. It has various parts. Head of the head, then neck, shaft, and the condyles. I have to draw it again. This is the head of humerus. It's a neck of the humerus, its shaft, and the condyles. And generally, fractures in childhood is supracondylar fractures and the sharp fracture of shaft. Then comes our forearms bone, that is our radius and ulna. Radius bone is our lateral bone and ulna is a medial bone. Its upper part is trochlea and shaft and the styloid. And same the radius bone, these are the two bones. It's a lateral bone that is outside of towards the thumb side, and this is our ulna bone which is towards the little finger side. And both are the long bones, and their length depends on the height of the individual. Then comes our carpal bones. These are 8 in numbers and arranged in two rows. The proximal rows towards the radius ulnar side is our scaphoid, lunate, triquetrum, and pisiform. And the distal row, trapezium, trapezoid, capitate, and hamate. These make two C-shaped rows, and these carpal bone provide uh, this carpal bone makes joint with the metacarpal bones. Metacarpals are 5 in numbers, and the head of metacarpal makes the knuckles of our fist. And phalanges, in the thumb there are only two phalangeal bones, and rest of the fingers they have three phalanges: proximal, middle, and distal phalanges, and they make metacarpal phalangeal joint, a proximal interphalangeal joint, and distal interphalangeal joints. After this bony uh, structures, now we could read about the various muscles surrounding our various muscle of the upper limbs. So first we will cover around the shoulder and scapula. Scapula, though it's a flat bone, but it gives origin to consists it surrounds with lots of muscles: rhomboidus major, rhomboidus minor, teres major, teres minor, supraspinatus, and infraspinatus, subscapularis, and serratus anterior. Few names you can, when we go, just go on the backside. Supraspinatus, this is spinus, this supraspinatus, uh, infraspinatus, as the name suggests, then subscapularis below the scapula. Rhomboidus major, rhomboidus minor, teres major, teres minor, and serratus anterior. Here I just want to tell you about the rotator cuff. Rotator cuff is made up of four muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. These four muscles makes the rotator cuff, and The importance of rotator cuff is that when the shoulder, the movement of our arm, that is humerus, and moves in the shoulder girdle, it stabilizes the arm, as deltoids is a very powerful muscle. So these small muscles has a very big role in the stability of the shoulder joint. Now, trapezius and sternocleidomastoid, these two muscles are helping muscles for the stability of shoulder joint. Then comes the major muscles of our arms, that is deltoid. It's our shoulder muscles which we see from our naked eyes, that is deltoid muscle. It's a multipinnate muscle, and it's covers our entire shoulder girdle. Then comes triceps. As name suggests, tri means it has three heads, and the biceps it had two heads. Biceps muscle, that is our main uh, arm muscles which we can see from our naked eye, and the triceps, our big muscles. Then the common flexures of the forearm, which originate from the medial side of the forearm, and lateral side, it is the common extensor. If there is some trouble in the extensor or some injuries in the extensors, it causes tennis elbow, which is very common. And on the medial side, it's a golfer's elbow. And the various muscles of the palms. Now we will cover various joint movements of our shoulder joint. Shoulder joint, it's a uh, provides all kind of movements which you can think of. Now, flexion, extension, internal rotation, external rotation, circumduction, and horizontal abduction, adduction, and abduction. So, shoulder joint is a uh, unique kind of a joint. It gives all kind of movements. Then comes elbow joint. Elbow joint generally provides two movement, that is flexion and extension. Radioulnar joint provides our supination and pronation. And wrist joint is again provide flexion, extension, and circumduction. Little bit of in internal adduction and abduction. And these are the small joints of the fingers which gives flexion and extension. And opposition is the main work of the thumb joint. Touching each and every finger is a opposition. So friends, so students, in this module we are we have learnt about the anatomy of upper limb. Just recap about the anatomy of upper limb. So we learned scapula, clavicle, that is collarbone, then the arm, humerus, radius, ulna, carpal bones, metacarpal bones, and phalanges. Thumb has only two phalanges and metacarpal bone. And humerus is a long bone of the arm. Then the forearm bones are radius and ulna. Carpal bones are 18 numbers: scaphoid, lunate, triquetrum, pisiform. Then the distal row is trapezium, trapezoid, capitate, and hamate. Then the metacarpals and phalanges, 5 in numbers: metacarpals, head of metacarpal makes knuckle of our fist, and thumb has only two phalanges, and the rest of fingers have three phalanges. The shoulder joint has various muscles. It's uh, periscapular muscles, which is rhomboidus major, rhomboidus minor, teres major, teres minor, supraspinatus, infraspinatus, subscapularis, and serratus anterior. Rotator cuff muscles are supraspinatus, infraspinatus, teres minor, and subscapularis. Then comes trapezius and sternocleidomastoid, which helps to stabilize our scapula. Deltoid muscle, which is our triangular muscle, triceps muscle, biceps muscle, common flexors of forearm. Uh, the minor injury of or major injury causes the golfer elbow, and the common extensors of forearm, which causes tennis elbow, and muscles of palm. Now, joints of movements, shoulder joint, which gives flexion, extension, abduction, adduction, horizontal abduction, and circumduction. The movement of a bowler is circumduction. Elbow joint gives flexion, extension. Radial ulnar joint gives supination and pronation. Wrist joint gives circumduction, flexion, extension, adduction, and abduction. So that's all for today's lecture. We will meet next and read about anatomy of lower limbs. Thank you so much.